Hi, my name is Ethan. I'm a dietetics intern at Missouri State University, and today we're going to talk a little bit about preventing diabetes. So I know we said we were talking about how to prevent type 2 diabetes, but first there's some other important things that we need to cover, such as how does our body regularly function, and then how does our body function when we develop type 2 diabetes. We're also going to look at some of the signs and symptoms of diabetes, as well as some of the things that might put you at risk. Finally, we're going to look at different tests that are available to make sure that we can prevent diabetes or know that it's coming well before it happens. So first, let's look a little bit about how a healthy body operates. Say you eat this bread, for instance. It's going to go into our stomach, and our digestive system is going to break down the carbohydrates in it into sugars. These sugars will then go into our blood, and it's going to tell our body that we need to make sure that we have less sugar in our blood. So that's when our pancreas gets involved. Our pancreas is in charge of making different types of keys. The first one that we're going to talk about is insulin. Insulin will come to our cells, and as you notice, our cells are locked right now. So we can't actually get our carbohydrates or sugars in there. So what happens is insulin will come along, interact with our insulin receptors, and cause it to unlock. Once it's unlocked, the sugar can go in. Now the thing is if our blood sugar drops too low, the pancreas also makes another hormone. This one is called glucagon. Glucagon also interacts with our cells, and it'll tell them to unlock. And it'll do something different. Instead of letting sugar in, it'll tell sugar to get out. And that means we can keep a nice and stable blood sugar. So now that we've talked about how the body normally operates, let's talk about what happens when you develop type 2 diabetes. All starts the same. We eat some food, our stomach and digestive system break that food down into sugar. Once that sugar goes into our bloodstream, our pancreas kicks in, and we start making our insulin again. So, all the same, until we start looking into what happens with our cells. So first off, we'll look at how insulin interacts with our insulin receptor. So when the key tries to go into the lock, it just seems to not quite go very easily. It has problems, it starts flipping around, can't quite get in. So our body starts producing more and more insulin until it can finally get a key into the lock. Once that happens, we can finally start getting our sugar into the cell. Here's the next area that is interesting to happen. While our cell doesn't have sugar in it, it starts screaming out that it's really, really hungry. And so what winds up happening is our pancreas says, whoa, whoa, whoa. We need to start making some glucagon. So this glucagon goes to our liver. And in our liver, it says we need to make sure that we have lots of sugar in our bloodstream so that the cells can eat. So our liver cells will actually start taking the sugar that they had originally inside of them and dumping it out. So while we're taking time for our body to even be able to unlock the cells, we're probably eating more food. And that's on top of the fact that our liver is also dumping sugar into our bloodstream. So we start getting a big buildup of sugar. But what's also interesting to see happen is our body has this interesting reaction where it knows that its cells are hungry. So what winds up happening is we get hungrier. So we start consuming more foods, forcing our blood sugar to go up even more. So the thing that we're really trying to prevent is all this sugar from building up in our bloodstream, because we can get a lot of problems that go on with that. So what we're trying to do is prevent type 2 diabetes for as long as possible, and if you do get type 2 diabetes, try and keep it in as good of control as possible. So now that we've talked about what type 2 diabetes is, let's list some of the signs and symptoms that you might see if you do develop type 2 diabetes. First, we have increased thirst, then frequent urination, increased hunger, unintended weight loss, fatigue, blurred vision, poorly healing sores, frequent infections, in particular urinary tract infections or UTIs, And finally, areas of dark skin on your neck or armpits. If you notice that you have any of these symptoms, talk to your doctor immediately. So now that we've talked about type 2 diabetes, let's go over some things that can increase our risk for developing it. So a big one that we actually look at is weight. If you have a BMI greater than 25, you're at an increased risk. That's not to say that people who have BMIs less than 25 can't also develop type 2 diabetes, but it's more common in people that are heavier set. Another big area is our weight distribution. So if we carry a large amount of fat on our abdominal region as opposed to on our thighs or hips, it increases our risk for developing type 2 diabetes. Other areas to look at are our activity areas. If you have long periods of sitting around, perhaps just because you have a very sedentary job, your risk can go up quite a bit. Next, we have family history. If you have family members with type 2 diabetes, it becomes more likely that you develop type 2 diabetes. This is the same with your race, being Black, Hispanic, Native American, or Asian American, your age. The older we are, the more likely we are to get it. As well as if you've had two different diseases. First, gestational diabetes. So if you've had gestational diabetes, meaning diabetes while pregnant, or you've had a baby that's greater than 9 pounds, you are more likely to develop type 2 diabetes. Another big area to look at is PCOS, or polycystic ovarian syndrome. If you've been diagnosed with either of these, your risk does increase quite a bit. So now that we've discussed type 2 diabetes, let's talk about where we go from here. There's a number of tests that you're going to want to get done on a routine basis just to ensure that you haven't developed type 2 diabetes. If you have, it'll help make sure that the symptoms don't get worse. So first, we want to make sure that your A1C gets tested. A1C is just a measure of how high your blood sugar has been over the past 3 months. We also want to take a look at your fasting blood glucose levels. Talk to your doctor about how often they want to do these tests. Other big ones that are important to have done are your cholesterol, including HDL and LDL, as well as your triglycerides. Developing diabetes can greatly increase our risk for heart disease. And so, by getting these tests done, we can help prevent heart disease as well. Finally, some big areas that are important to focus on is dental and eye. You should see the dentist and your eye doctor at least twice a year to make sure that there's no complications coming about from having higher blood glucose levels. So to wrap this up, let's talk about the big areas that we hit today. We talked about normal body function versus the body function when a person has type 2 diabetes. We noted that a lot of sugar starts building up inside the body when we develop type 2 diabetes. So this is something that we really want to stop. We also looked at the signs and symptoms of type 2 diabetes. Now remember, if you get any of these signs and symptoms, be sure to talk to your doctor as soon as possible. They can do tests to see whether or not it's something else or if you have developed type 2 diabetes. We also looked at some of the tests that we should have done regularly. Sometimes you can get type 2 diabetes and not even know that it occurs. A lot of these tests, such as your A1C or your fasting blood glucose, can help determine whether or not you have type 2 diabetes before the symptoms actually start to happen. This can stop a lot of long-term damage. We also talked about some of our risk factors that we see. Now, just because you have risk factors doesn't mean that you will get the disease. Please watch the rest of the videos and we can try and figure out ways that we can reduce our risk for getting diabetes as much as possible. Thank you.